Leader to Leader, Conversations with State Officials. The ARC of Pennsylvania hosts an interview with Dr. Rachel Levine, Pennsylvania's Secretary of Health, by self-advocate and the ARC of PA board member Joshua Stranix. The Leader to Leader series is an opportunity for individuals with disabilities and their families to hear from state leaders about present and current issues impacting the disability community.
And welcome to another episode of our Leader to Leader Conversations with Decision Makers in Pennsylvania. And today we are honored to have Dr. Rachel Levine, the Secretary of Health, who has been quite the leader through this pandemic. I think that we have all grown accustomed to seeing Dr. Levine in her unflappable way of presenting the facts. And sometimes the facts were very difficult to present. But I just, for me personally, Dr. Levine, there was great comfort in your message. You were always steadfast, and we appreciate your service to Pennsylvania, and particularly to the intellectual and developmental disability community. And before I turn it over to Josh, I cannot go without thanking you for your service, but also recognizing that the intellectual and developmental disability community is quite the vulnerable population when it comes to the COVID-19 pandemic. And we cannot forget all of the direct support professionals that have been working tirelessly to keep our individuals safe. And I believe that our numbers have been relatively low when you compare to other congregate living situations. So we are proud of our direct support professionals. And I have to give them the plug, Dr. Levine, because sometimes we are overlooked. But Dr. Levine, thank you and welcome to the ARC of Pennsylvania's Leader to Leader discussion.
Well, thank you so much. And I do want to also highlight the fantastic work of direct care professionals. They are really heroes during this very challenging time. Thank you.
Joshua Stranix is a member of the ARC of Pennsylvania's Board of Directors, and he is an outstanding self-advocate, and he is very used to presenting on the Hill. So Joshua, I am going to turn it over to you.
Thank you, Sherry. Question 1. Every fall doctors talk about the importance of getting a flu shot to protect us during the flu season. What should we know about this flu season and the virus?
Well, thank you for that question. And it's something that I've been talking about a lot. It is so important for all of us to get a flu shot this year. It's always important, but it's even more important this year. So obviously we are struggling with the global pandemic of COVID-19, really one of the biggest public health challenges that we have faced in over 100 years. But we have flu that comes by every year. And we're very concerned about individuals who might have COVID-19 and the flu and how seriously ill they might get. Also, we have, thousands and thousands of hospitalizations every year from the flu. And we do anticipate that our hospitals could be challenged by COVID-19. So the best way that all of us can protect ourselves from the flu this year is to get a flu shot. It is easy, it is safe and effective. You can get a flu shot from your doctor, from your clinic, or really from a pharmacy, or often at the pharmacy at the grocery store. So please, everybody get a flu shot this year.
Thank you. Question number 2. Dr. Levine, I work at my local giant food store. When I go to work, I must wear a mask. In fact, wearing a mask is mandatory for all giant employees. Could you talk about the importance of wearing a mask and social distancing and limited spread of this virus?
Well, thank you so much, Josh, for bringing that up. It is such an important point that I really try to mention every day that I'm speaking to the public. As I was saying, this is really the biggest public health crisis that we have faced in over a century. COVID-19 is a very contagious respiratory virus and a potentially very, very serious virus. We are in the middle of our fall resurgence. We are seeing an increasing number of new cases of COVID-19 throughout Pennsylvania, in all regions and almost every county of Pennsylvania. And we expect that trend to continue. It's the same trend that's occurring across the United States. And one of the best ways that we can protect ourselves is taking some very simple public health measures. And the first is wearing a mask. It has been shown scientifically that wearing a mask can protect you and protect other people from COVID-19. And so if I'm wearing a mask and you're wearing a mask, the whole community, we're all protected against the spread of COVID-19. And so it's such an important and really simple thing to do whenever we're in public. If we're in public indoors, especially, but even if we're in public outdoors, is for everybody to wear a mask. In addition, we want people to wash their hands and to use hand sanitizer if washing your hands isn't right available. And we want people to social distance, to stay at least 6 feet apart. And if everybody did that, then we would have less cases and we'd have less deaths. So, I know that it's a challenge to remember those all the time, but I really strongly feel that we all have a collective responsibility to ourselves, to our families and our neighbors to do these simple things. And if we do them, we'll all be safer from the spread of COVID-19.
Thank you. Number 3, I sometimes see people coming into our store who are wearing a mask. I see people in other places that are not wearing masks. How could I explain to other people about the importance of wearing a mask?
Well, thank you for bringing that up. I think we all have a responsibility to each other to look out for each other. And by wearing a mask and doing those other simple things, washing your hands, hand sanitizer, and social distancing. If you see someone in a public place that is not wearing a mask, I think that it is reasonable to ask them about, or just to say, please, if you can, please wear a mask. There are some people who have medical conditions where they cannot wear a mask. They might have maybe some forms of heart disease or lung disease where they actually can't wear a mask. There are some people with disabilities who cannot wear a mask. And so that's okay. By the rest of us wearing a mask, it offers protection to the public. But I also think it's important that we not get confrontational. We don't want people to have serious arguments or even physical fights and confrontations. So you can't make somebody else wear a mask if their decision is they're not going to, and we don't want people to have those type of very serious confrontational interactions. So if you mention it very politely and someone says they're not going to do it, then I would walk away and stay 6 feet away and let it go. In terms of our responsibilities in public health and in government, we'll continue to work on it. But we don't want people to get into either serious arguments or physical fights.
Thank you. Question number 4. This is concerned that people with disabilities who get the virus and need hospital care may not be allowed to have their parents or another caregiver with them into the hospital. If a person with a disability needs to be hospitalized, can my parents or another support person go along with me to help me talk to the doctors and other medical staff about my condition and my care?
So yes, you can. With the global pandemic, hospitals are according to the discretion, implementing specific visitor policies and trying to limit visitors as much as possible. The concern is that sometimes those visitors, though they might not know it, could have COVID-19. They might not be symptomatic in any way, but then it could spread the virus within the hospital. So they are instituting some visitor policies. But really, according to federal and state law, a hospital can't deny, an attendant, a caregiver, or a family member from joining a patient who has an intellectual, developmental, a cognitive disability, communication barrier, other behavioral issues, or a physical disability. So, patients have rights, and so they can't prevent you from having that. But I think that they are trying to prevent visitors as much as possible, since the COVID-19 is spreading, to try to prevent the spread in the hospital. So it's a balance, but we know that people with disabilities will might need their parent or caretaker, and it's allowed for them to join.
Thank you.
Sure.
Our final question. I am concerned that people with disabilities will get this virus more than other people. Can you share what you are seeing in Pennsylvania for people with intellectual and developmental disabilities and the impact of the virus on them?
Sure. So that's a very important question, which has a number of different points. So certainly, individuals with certain medical conditions are more prone to getting the virus and more prone to having a very serious reaction to virus. That can include the seniors with different, 65 and older with various types of dementia, but also individuals with, particularly with high blood pressure, with heart disease, with lung disease, with kidney disease, diabetes, and other types of those medical conditions. And so we see higher numbers of those patients in the hospital and higher numbers of those patients with those physical problems who are having, very severe cases of COVID-19. Some of those conditions are more common in individuals with some intellectual and developmental disabilities, and that puts them at risk. But we have not been seeing specifically more patients with intellectual and developmental disabilities themselves without those other medical conditions who have been hospitalized or having more serious reactions. I think that they might be more at risk. I mean, there are some people with intellectual and developmental disabilities that can't wear a mask. And so they might, that might be a risk. We know that some require caretakers to have a lot of physical contact, which might put people at risk. But overall, I think we're doing really well in terms of keeping patients with intellectual and developmental disabilities safe. I think that that's due to everybody's efforts. I think it's due to the individuals themselves and all of their efforts to stay safe. I think it's due to their families' efforts, and I think it's due to the brave efforts of all of the caretakers who are caretakers who are really doing everything they possibly can to keep themselves and their patients safe. So I think everyone's doing a fantastic job, and I think that the numbers show that.
I want to thank you so much for all the hard work and dedication that you put in every day at the Department of Health. Thank you so much for the interview. Thank you so much.
Thank you. You did a great job, Josh. I was just such a pleasure to speak with you. And it's really important to get this message out. And so my final statements, if I may, is that, we are all in this together. What COVID-19 has certainly taught us is that we're all so interconnected. And I've mentioned before, I firmly believe that we have a collective responsibility to each other, to our families, to our neighbors, to our communities, and really to everyone in Pennsylvania and in our nation. And I think that if we all stand united together and we do some of the simple things that we had talked about, and we all work to help each other, I think that we will be successful in our battle against COVID-19. And so thank you so much for allowing me to be here today.
Thank you, Dr. Levine. It's been our pleasure, and we look forward to continuing to work with you. After the pandemic and we get on with other issues, I hope that we get to meet in person someday. It's just been a real pleasure, so thank you.
Absolutely. Well, thank you. And thanks, Josh. You take care.
You too, and be safe.
You too.
Thank
Bye-bye
you.
now.